Hello, my name is Sarah Dooley. I'm with Atlantis Community. We're a center for independent living here in Denver, Colorado. Um, I want to thank you for joining me here today. I'm going to go over what we call the All of Us research program. Atlantis has joined partners with the American Association on Health and Disability, as well as the National Institute of Health, to promote this program. It's actually a really exciting program, which gives us as individuals the opportunity to be a part of the future of medicine, specifically precise medicine, which tailors to the individual instead of the average patient. So I'm going to take a couple minutes of your time, go over what this is and how you can be a part of it. So let's start off with what is the National Institute of Health All of Us Research Program. The All of Us Research Program is a historic longitudinal effort to gather data from 1 million or more people living in the United States to accelerate research and improve health. By taking into account individual differences in lifestyle, socioeconomics, environment, and biology, researchers will uncover paths towards delivering precision medicine or individualized prevention, treatment, and care for all of us. So what that means is that we're trying to move out of that one-size-fits-all model and really pay attention to the individual instead of the average patient or whatever it is that's being treated. So what is precision medicine? Precision medicine is an emerging approach for disease treatment and prevention that takes into account individual variability in lifestyle, socioeconomics, environment, and biology. It's a radical shift in how each of us can receive the best care possible based on our unique makeup. This is transformational for the National Institute of Health, recognizing lifestyle and environment, not just the biology, moving towards more of the social construct for disability. Well, I don't know about you, but I know I have gone into the doctor's office, and there's a lot of trial and error, especially when you are dealing with complex illnesses. There's side effects from drugs. This worked, it didn't work. Try this one has a side effect. This is what they're trying to do with precision medicine is really be able to pay attention to the variabilities of each individual. So what are some examples of precision medicine? It's the right treatment for the right person. Things such as prescription eyeglasses, insulin pumps, blood transfusions, hearing aids, all types of different things. So what's the cost of imprecise medicine? For patients, healthcare is often targeted to the average patient, not the individual. Health problems can take years to unravel with significant trial and error. Just like I had said before, each one of us have so many different things going on, specifically in the disability community. And to be able to find a good treatment or preventative treatment or cure for whatever it is going on with us as individuals, imprecise medicine really doesn't focus on that. It's just about treating the average patient. As far as providers, there's not enough research to draw for clinical evidence, especially in diverse populations. Medical records are scattered in different places, and there's not enough time for the analysis of one patient at a time. I believe 100% that the intention of every provider is to treat the individual. But first of all, if they don't have all of that information in one spot, it's hard to be able to see someone as a whole person, as well as just with all the new information coming in, all types of different, waiting on research, all types of different things coming up. It's really hard to be able to have the time to look at the individual and be able to treat the person as that unique person. As far as researchers are concerned, there's an enormous time and cost spending building IT systems versus doing research. These researchers, they're getting grants for 3 to 5 years, and they spend up to 40 to 70 to 80% of that time building IT infrastructures and computing and the data and how do they secure the data. And they spend even more time trying to find people to recruit to participate in the study. 85% of clinical trials have to stop early because they can't recruit enough people to be a part of that. There's siloed data, resources, and funding opportunities, challenges in acquiring large sample sizes, and slow translation of data into knowledge. So what the All of Us research program, really the goal is to create a pool of information so that researchers can continue to pull from that pool as they do their research. And the faster they can do the research, the faster that they can treat us as individuals, they can get it to the providers and then treat us as individuals who are needing that treatment. So what are the different activities asked of participants? The first thing is that they ask you to enroll, consent, and authorize your electronic health record. This is for people who are 18 and older. There are online interactive consent forms, and it includes an authorization to share your electronic health record, which is your health history. You'll be answering surveys. There are first 3 initial surveys over basics, overall health, personal habits, and then additional surveys will pop up as the program comes along. They'll ask for physical measurements, blood pressure, body mass index, heart rate, height, hip circumference, waist circumference, and weight. They will ask to provide biosamples. There are 2 options for biosamples. There's blood or saliva. Saliva, obviously, if the blood is unsuccessful, or whichever one you choose. There's a urine specimen, and the biosamples will be stored at a program's biobank. One of the really cool new things with this program that they didn't have before is that they are providing wearables and digital apps, like Fitbits. And what is expected when you're wearing those Fitbits is that you share the data on the wearable device. Share data about mood, cardiorespiratory fitness throughout the integrated apps. And there's going to be more integrations to come. So again, the different survey modules, the enrollment surveys are the basics, overall health, lifestyle, personal health history, family history, healthcare and access and utilization. So what are the values of All of Us? Participation in the All of Us research program will be open to interested individuals. Again, the whole point in this program is to get a diverse sampling of America so that they can take all of those different variables into account. The disability community as a whole, this is a huge part of that because the disability community is dealing with a lot of medical issues, multiple medical issues in a lot of cases. The program will reflect the rich diversity of America. Participants will be partners in the program. They are not considered patients. They're not considered anything other than a partner in the program. You'll be an active part of this. Trust will be earned through a robust engagement and full transparency. Participants will have access to information and data about themselves. That's one of the great things about the program as well. You're not just providing the information to researchers, but you also get that information from yourself that you can reference to or you can bring to your own providers. Data from the program will be broadly accessible to empower research. The program will adhere to the PMI privacy and trust principles and the PMI data security policy principles and framework. They take security very seriously. The program will be a catalyst for innovative research programs and policies. Nothing about us without us. A transformational approach to diversity. This is reflecting the country's rich diversity to produce meaningful health outcomes for communities historically underrepresented in the biomedical research. They're really trying to reach those communities that just haven't been focused on previously. Right now, we're stuck with treatments that are being provided based off of average patients, based off of research previously for whoever was available to give that information to the research. It might not be exactly who we are as unique individuals. A transformational approach to participation. Participants in the All of Us research program will be true partners, not patients, not subjects in the research process. You're involved in every step of program development, what data they collect, what lab analysis they do, what research is conducted, and how data gets returned. A transformational approach to data access. Data sharing will be a priority to both researchers and participants. Participants will have access to study information and data about themselves, so you have access to all of that information. Data collection will start small and will grow over time. Obviously, with more participation, there'll be more data, more research. Privacy and security will adhere to the highest standards. National Institute of Health will invest to level the playing field so diverse researchers can play. So they are also looking for diverse research participants as well. What is the promise for participants? It's an opportunity to help fight disease and improve the health of future generations. It's an opportunity to ensure that your community is included in the studies that lead to new understanding and new treatments. The choice to meet others like you, perhaps even joining some of them to propose and do research. This is a long-term relationship, and the value to participants and researchers will grow over time. What is the promise for researchers? It gives you the opportunity to save time and resources and accelerate your research breakthroughs. Instead of spending your time trying to find participants and trying to get all the information together, you can focus on the actual research. The ability to share workspaces and analyses with research partners and reviewers, and the chance to learn from the program's pilots and experiments and leverage innovations for other studies and cohorts. As with most studies, we are collecting, evaluating, and curating initial data sets. So this is pre-curated, pre-collected information at the disposal of researchers. Approach to the privacy and security. When I speak about the All of Us program, this is one of the biggest topics that gets discussed. Obviously, this is very personal information, so how do we know that's protected? Well, it's guided by privacy, trust, and data security principles developed by experts with input from the public. Data warehouse is built with the most advanced security available. Experts have done and will continue to do rigorous security testing. Data is encrypted and direct identifiers are removed. So your name is not attached to the information. It's just the information about yourself that is getting put into this pool for the research. You are not attached to that outside of the initial intake to the program. Researchers must agree to a code of conduct before accessing the data. So the researchers are vetted before being allowed to use this data. Participants' preferences will be respected. It's protected by a certificate of confidentiality. And there's always a chance that there would be a data breach. What they commit to is transparency in the event of a data breach. Safeguarding your identity and data to the best of anyone's abilities is their most important responsibility. So there are all types of partner sites all over the United States. Atlantis Community being the one here in Denver, Colorado. There's one in Boston in the Boston Center of Independent Living, Chicago, the Progress Center for Independent Living, the University of Montana Rural Institute in Missoula, and the Independent Living Research Utilization in Houston. They're really trying to get all over the United States because there's different demographics in different parts of the United States as well. So if this is something you seem interested in and you want to be a part of this groundbreaking research, please go to joinallofus.org, which is JOINALLOFUS.org for more information. And you can also join there. There's also videos you can watch just to get some further information. So again, this last slide is just showing you the Fitbits that you will get. You will be able to keep those after the biosample is completed. The eligibility requirements is completed electronic health record consent, completed first 3 surveys, and you have provided your biosample. So thank you so much for taking the time with me today. This is a pre-recorded video. I do want to say that I will be available for live answers in the comment section. Let me see when. Sorry about that. Tuesday from 8:30 a.m. to 11 a.m. Mountain Standard Time. That's June 21st. And on June 23rd, which is a Wednesday, So the 21st would be a Monday. I apologize. June 21st, Monday, from 8:30 a.m. till 11 p.m. Oh my goodness. I'm going to get this right. Let me pull it up on my phone so I can look at it. Okay, so my live answers will be available on Monday, June 21st from 8 a.m. to 11 a.m. And then again on Wednesday from 3 p.m. to 5:30 p.m., June 23rd, Mountain Standard Time. Please feel free to ask questions in the meantime. I will answer them during those office hours, and then you should get a notification stating that I did respond to your comment. Other than that, please feel free to reach out to me at sarah@atlantiscommunity.org, which is SARAH @ATLANTIS LANTISCOMMUNITY.org. And really quick before I let you go, I do want to let you know that there are two ways to sign up for this program. You can do it online with the Join All of Us, or you can do it via an app on the phone. I did it that way. I looked up All of Us, and it was right there on the apps, and it's a really simple way to go through the process. You put it in your email address, you create a password, and during that, it also gives you a breakdown of what tasks you still have to do, what order to do them. So it's a really simple way of doing that. So again, please, if you have any other questions, please don't hesitate to reach out, and I hope you have a great rest of your day. Thank you so much.